With strong support from our medical staff and our administration, the Florida Hospital Blood Management Program was created 3 years ago. This program is a patient-centered, multidisciplinary, and evidence-based, with the ultimate goal of improving patient care by optimizing the use of blood and blood-related products. The goal of our program is not to stop blood transfusions, but to decrease the number of inappropriate transfusions by adherence to evidence-based transfusion guidelines. According to the National Blood Collection and Utilization Survey, over 21 million blood products are transfused in the United States per year, and well-designed studies have shown that around 50% of all transfusions are considered inappropriate. Inappropriate transfusions also result on increase in healthcare costs and affect patient safety by increasing the risk of mortality and hospital-acquired complications. It was in response to all these changes and new evidence in transfusion medicine that the program was created.
Healthcare is undergoing a delivery system reform, where we are focusing on better health and better care at a low cost by eliminating waste. The old SGR that we were accustomed to was replaced in 2015 by Medicare's Access and CHIP Reauthorization Act, or MACRA. This introduced the MIPS system, which is a merit-based incentive payment system, an alternative payment model that combines familiar metrics like PQRS, physician value-based payment modifiers, and the Electronic Health Records Incentive Program, all under one new system. In 2016, 30% of our Medicare payments will be tied to models like these, and by 2018, 50% will be. So, one of the biggest opportunities for us to improve outcomes and patient safety is through the recognition of the magnitude of avoidable complications, particularly unnecessary transfusions that have both a direct and indirect cost. Through programs like patient blood management, we can use evidence-based medicine to reverse the erosion of the risk-benefit equation when treating patients in a cost-conscious system.
As a result of the blood management strategies that have been implemented, there has been a significant decrease on unnecessary transfusions, a decrease on the number of transfusion reactions, and an overall increase in adherence to transfusion guidelines. These accomplishments have positively impacted the quality of our patients.
I know that transfusions are always available. However, there is even a better way, the partnership, and that's the surgeon and the patient. Very simply, I changed the way I'm eating. Secondly, before I went into surgery, we discussed consideration about an infusion. Now that sounded very foreign to me because I didn't know anything about it. We talked about it extensively. I did have an infusion. It changed everything. The procedure, the surgical procedure was very smooth. We didn't have to have any other supportive blood that we might have needed had we not had the opportunity of the infusion. The surgeon here, Dr. Cole, is fabulous. His entire office took time explaining everything to us, to both my husband and myself.
It's our responsibility as physicians to decrease inappropriate blood transfusions and use alternatives to treat anemia so patients like Betty can receive outstanding care. But including our patients in the decision-making and truly evaluating the need for a transfusion, we can help to decrease the need for unnecessary blood use.
To assist with our 2016 initiatives, new power plans and transfusion order sets will be implemented in the second quarter, which will help to standardize transfusion practices. It is imperative that we gain your support for these new strategies on appropriate blood management and continue to follow appropriate transfusion practices, like restrictive evidence-based transfusion practice, the use of single red blood cell transfusion units on stable non-bleeding patients, and to think about other options to treat anemia, like IVRN. So we want to thank you for your support of your patient blood management program here at Florida Hospital.